Colleagues, now we're going to have Dr. Moshe Modiselle, who is the immediate past president of the South African Society of Nuclear Medicine. He's going to deliver the biennial Chris Jansen Memorial Lecture, and he's presenting virtually.
Thanks, colleagues. I hope you can hear me clearly and you can see me there side. Thanks really for allowing me to give this lecture virtually this year. I've already sent my apologies to the committee, the organizing committee. I know they've already forgiven me. But I would also like to humbly extend my apology to you in the audience, also for keeping you until this time. Most of you are likely looking forward to going back home. So I'll try to be short. I'll keep it short as possible. And I really hope that you've enjoyed this year's meeting. And one would also like to congratulate the organizing committee really for pulling and executing this mammoth task, especially during this tough economic circumstances. I know the work behind, they really struggle. But also to our sponsors, really, thank you for always making sure that these events take place, despite all the economic challenges. So for this year, colleagues, I decided the theme, as you see, it's beyond contentment. So it is expected when one reaches a certain level of maturity that's associated with certain changes in their life. So the brain might start functioning much better. I think most of us would really agree with me. If you look back in your 20s, compared to now, later in years, the brain functions better. We are more decisive in terms of making decisions and planning. Even though with time, this might start dipping a little bit. Mentally, some might start saying really they are quite content or they are satisfied. Some might say very satisfied. But sadly, the immune system maybe might start dipping a bit, it starts weakening in some. Hearing might start deteriorating. So I think many of you by now are already catching up where I'm going with this. So the list is endless. The bone starts deteriorating as well. One starts experiencing the joint pains. Next year, colleagues, the South African Society of Nuclear Medicine will be 50 years in existence. So this means that it's now time again for us to really reflect, assess ourselves, and also see that where are we in terms of our needs? If we look back, did we really achieve our goals? And also what's our action plan? So I think if we look back a decade ago, those who were gathered in Paris probably remember when Prof. Bangu mentioned that life begins at 40. And he really asked a very valid question. Are we really where we want to be in life as a society? And obviously, as we get to 50, some might say life starts getting better, but yes, age might work in our favor. Obviously, not all of us will experience the sunnier outlook in our 50s and beyond. But some of the challenges that were highlighted back then that I'd like also to remind the colleagues as we reflect on ourselves, are we really happy where we are at the moment? I'll just mention some of the key things that he highlighted with the teaching and research, service delivery and employment. And as SASNEM 10, 50 years and beyond, what are we expecting? What challenges one is anticipating? So, and also to reflect and look, are we still an inclusive organization as we say we are? Just last week, I was surprised. I met someone who said, what does SASNIM even do? So I think this is a challenge to all of us that all those who are involved in our field, we really need to educate our members and that they become active members of the society, especially everyone who's involved in the practice of medicine, to be active members of the Society of Nuclear Medicine. In terms of teaching, one of the key things he highlighted that meeting every 2 years, is it really sufficient? Obviously, with COVID, we had to shift the goalpost a bit, but we can safely say improvement. There's a bit of improvement. Education. We tried to have meetings in between. Colleagues would recall that we had few meetings, like the master class, the webinars, a lot of online and case presentations as well. And there's regular updates currently online now. Then I must say things have slightly improved, but there's more we can do. One question that keeps popping up is the issue of the journal. Can we have the local journal? I don't think we are satisfied because this keeps coming every time we meet. So clearly, we are not satisfied. We really need the local journal. So the seed has been planted, colleagues. I think those in the audience, are we really looking forward? Can someone really water this and see the seed growing? So that's the challenge for those who are in the audience, that maybe we really need to look at this. It can start with a yearly journal and we progress from there. Research-wise, is in the past, we've indicated that the limitations regarding the resources, but I think things have improved. The amount of research that is available now, clearly the resources are there and we are able to do more innovative research, which obviously translates from bench to bedside, and we are able to diagnose and treat at the molecular level. This advances, colleagues, are clearly seen. They're clearly visible by all. I mean, the attention that theranostics has gained over the years, and this advancing software equipment as well. So there's a lot of development in that regard. But the question still remains that at the age of 50, will we be satisfied? Can we look beyond? So yes, we can do more. We hear a lot about collaboration. This I'll put as a challenge to academic institutions. Is there a willingness to collaborate as academic constitutions? Do more research locally? Yes, I know we've got a lot of involvement outside the country, but with so many academic institutions, we can really work together and collaborate. And also, one would say clearly with what has been presented, obviously, artificial intelligence is here. So one would obviously see that there's huge potential in that area, and it's one of those changes that we'll have to embrace and start working on it. So one would really look forward to seeing all of us doing more research, collaborative research, that obviously translate to the next challenge, which is service delivery. Why are we doing all this? Are we doing it for ourselves? Are we practicing this nuclear medicine for ourselves, or is it for our community, our patients? So this really reflects on us as a Society of Medicine. Is this really having impact to our community? And how can we improve both the quality and the of our patients? So we really know the impact that nuclear medicine has and all these advances in our field in terms of patient quality and patient outcome. And we've seen over the years the application for PET really continues to grow. But the challenges, cost and availability, still remain the main barriers. So majority of our patients still today, they still have to travel long distances for this because our services are limited. So are we satisfied with the service that we are offering to our community, or can this be extended further to those in secondary hospitals? Why we still don't have secondary nuclear medicine in those hospitals? It's something that we really have to advocate for. Service delivery also affects that employment also. Are we creating enough? Over the years, I've seen so many of our colleagues being trained, not having posts. Really, all of us by now should be not struggling to get posts with the level of training that we're getting and the service that we can offer to the community. One really would expect that our population of 60 million really needs our friends to really, we can really help them. The other thing with human resource, yes, we spoke about the ratio, but one would still say that we cannot cater for the 60 million population. With the numbers we have, we still have limited resource in terms of physicists, radiographers, nuclear medicine radiographers. Many, yes, still leave the country, but they come back. And radiopharmacy as well, there's still a shortfall. Nuclear physicians as well. So the challenge is that can we train more? Can we still train more so that we can create this opportunities? But also as we create these opportunities, one would want to be careful, be cautious of those we get. The level of transparency is, are we happy with those that are involved, or who are to partner with us in this field? As I've said, colleagues, I would not want to keep you long. So yes, life started at 40. The challenge that I'd like to put to the colleagues in the audience, the ones that are the younger generation, below 50, I'd say, thank you so much.
Thank you so much, Dr. Modiselle, for the Chris Jansen lecture.